Welcome to another episode of Kinetics College with iPass. So, to those who are taking time to attend this lecture tonight, wherever you are, whether you are in the Philippines or anywhere outside the Philippines, so in United States or anywhere, so I'd like to thank you for taking time to attend this lecture with me. So I believe that for 10 days from now, so we will be having our full implementation of the next generation NCLEX. So tonight we will be dealing with strategies to answer NGN type questions. So I intend to focus tonight more of standalone questions so that you will be able to be certain on how are you go about dealing with different types of questions rather than these case studies, because as we all know there will be like 25 percent new question types that's going to be out this April 1 of 2023, and part of it will be the case studies which the examinee will be having at least, or will be getting at least 21 uh, 18 rather 18 questions from these case studies. On top of it there will be like additional 21% new question which will be dealing about the standalone questions. So definitely the bulk of the question for the NGN types will be basically focused on the standalone questions with the additional of what we call case studies. So as I've mentioned, I intend to discuss with you tonight the different item types and also with strategies to answer it. So without further ado, let me share you my screen. Okay. So Miss Melanie, can you share my screen? Okay. So okay. Miss Melanie, is it am I going to because later on I'll be sharing the screen, so probably the students perhaps will then write because of some technical issue with my connection right now. So I wasn't able to upload my presentation today. So Miss Melanie from Kinetics uh, is gonna share my screen on my behalf. So later on, during integration of some incidental learning or informations, please take time to write there on your piece of paper so that you will be able to get the gist of the questions or the informations. So basically, with the next generation NCLEX, as I've mentioned, um, coming April 1 of 2023, there will be a test competency. This is going to be a new format of NCLEX. So it measures the competency of the nursing applicants. And one thing is certain, the entire computer itself is computer adaptive testing still. So meaning to say questions are geared towards to the level of the persons completing the examinations. So questions are reflective. These are reflective of the nursing practice today, and this will test your clinical judgment skill. So once we say of the clinical judgment skill, we define that as a result of the critical thinking and the critical decision making. And for you to be able to safely render quality nursing care to the patient, it requires the nurse to employ these nursing process. Basically, these clinical judgment models, the nursing process, they intend only to categorize this into 6 functions in order for you to become very familiar on what are these steps. So these steps comprises from your recognized cues, analyze cues, prioritize hypothesis, generate solutions, take actions, and evaluate outcomes. So as I've mentioned, this is basically a nursing process. So in the nursing process, we intend to analyze, we intend to assess as a first step, to analyze, we plan, we implement, and we evaluate. So in this session, we will be dealing on some specific item format that is focus on recognizing the cues, and later on I'll be giving you some important strategies on how are we going to attack this question sa NCLEX. Okay, so next, Miss. Okay, so let's now move on to recognize cues. So let me go ahead. Start my presentation. So that is the first step is your recognizing cues. So in recognizing cues, remember nurses, you have to ask yourself what matters most with this. So you're going to definitely use these informations that is gonna be presenting you in the in the tabs that you will be getting during your actual examination. So here I intend to give you a sample about the drop down close. So a drop down close is a new test format which aims the nurse to select options from the given drop down. So all as you can see with this example, so there will be a scenario, there will be a tab here. So for example, the nurse's notes, and these are the questions. And the following are your tasks. So your task is to complete this drop down clause. So let me go ahead, read the scenario. So what is this drop down clause or the scenario all about? So number one, so the nurse is reviewing the nurse's notes for an 84-year-old client admitted to a skilled nursing facility or SNF. So during the examination, you will be presented with different tabs. So the technique here is to take time to read and open all the tabs that is being provided for you because the informations are given to you. So with this, our task is to recognize cues. We need to find out what are the most important cues that matters because this may give us opportunity to identify whether the concern of the patient is immediate or not, something that the nurse has to intervene immediately or to take action immediately. So it goes, the nurse's notes goes like this in 2100. The client transfer from the community hospital following a right total knee amputation for physical therapy or occupational therapy. Son states that father has been confused at times since surgery but has no previous diagnosis of dementia. So needs supervision when transferring from bed to chair, incontinent of urine at times, able to feed self and needs assistance with bathing. The patient had episode of fell yesterday. So patient had fell yesterday while in bathroom while unattended with walker. So vital signs are the following: temperature of 98 degrees Fahrenheit or 36.7 degrees Celsius, heart rate of 88, pulse rate of 18 beats per minute, the BP of 102 over 64 millimeters mercury upon in the sitting, measurement in sitting. So the right knee incision is dry and intact with stair strips. Currently, patient is alert and oriented. The nurse has took this assessment for 3 times. So history with hypertension, transient ischemic attack or TIA. The patient also had history of stress incontinence and osteoarthritis. So our task here is to recognize the cues. So based on this information or nurse's notes, question is, based on the client's finding, okay, complete the following sentence by choosing from the list of options provided. So these are the drop down options already. So the nurse recognized that the relevant client findings that are of immediate concern to the nurse are. So in this example, your task is to identify three immediate concerns. From this option, for option one, the drop down should be RR of 18 beats per minute, BP 102 over 64 millimeters mercury upon sitting, and heart rate of 88 beats per minute. So what do you think is the answer here? Actually, I cannot see any. Let me check my phone right now so that I will be able to check whether whether there are participants already. Okay, so let me check. Okay, so here, okay, so any guess with the option one? Immediate. So the concern here, the nurse recognizes that relevant client findings are of immediate concern. So I intend here to highlight red the immediate concern to the nurse based on the nurse's notes. Can anyone or can somebody answer option one? Okay, any guess? Okay, any guess, guys? Okay, so let's answer here BP of 102 over 64 millimeters mercury upon sitting. Okay, so number two. So what are the possible, what is the possible answer for option two? So you just have to click this and options will drop down. So hence the word drop down close. So confused at times since surgery, so history of transient ischemic attack and admitted for PTOT after taking after a total knee amputation. Any answer? Any guess for option two? Okay, correct. I saw Miss Yolanda Aguinaldo Ascension. So Miss Aguinaldo mentioned about BP, correct. That is for option one. So this time for option two, any guess? Okay, any guess from the participants? Okay, any guess from the participants? So this time, okay, I'll be selecting here confused at times since surgery. Okay, so I'm intent to choose confused at times since surgery. And number three, okay, any guess for number three? So options are fell yesterday, alert and oriented times 3, and incontinent of urine. Okay. So correct. So correct. Answer there is confused at times. Correct. So in option 3, does anyone from the group? Does anyone? Okay, thank you so much, Miss Jen Birung. Fell yesterday for option 3. So let's answer again for option 1. So we have we think of this immediate concern that the nurse has to react. Okay, so we selected for option 1 BP of 102 over 64 millimeters for sitting, and option 2 for confused at times since the surgery, and option 3 the patient fell yesterday. So let's now go ahead with discussing the rationale. Okay, okay, let's go ahead. Can you move the slides, ma'am? Okay, so what is now the rationale for this? Remember guys that the client is an older adult. So the client is an older adult who had a surgery several days ago before admitted to the skilled nursing facility. So analyzing the following cues, so we already established that the vital signs are within normal limit except for one, blood pressure. Why? This blood pressure seems to be low. Not within the normal limit, and it's very low, 102 systolic and 64 millimeters mercury as diastolic. So it is also important, guys. It is basically expected for a normal adult to have a slight decrease in systolic and diastolic pressure when we change our when we move or change from sitting or lying position. But remember, with this scenario, the client is adult. So the client is elderly client. So it is expected that the patient, based on that cue, the patient is suffering probably from orthostatic hypertension. So what is this orthostatic hypertension then? So when there is a significant decrease in systolic, so I will never write here. I cannot write here. So kindly write there the answer in your own in piece of paper that you have right now. So just to facilitate the learning process. So what is this orthostatic hypotension again? So when the patient, there is a decrease in systolic pressure for at least 20. So right here, 20 millimeters mercury, or diastolic of 10, millimeters mercury within 3 minutes of moving. Okay. So magic number is 20 for your systolic and 10 for your diastolic. This is what we call orthostatic hypotension. So what is now the importance or significance of understanding this orthostatic hypotension in terms of my patient based on his cues? So remember that this orthostatic hypotension may contribute to what we call fall incident. Okay, so fall incident, and also remember that the RR and heart rate are seems to be the normal limit. So except for the BP, so it is expected that the patient is having or experiencing an orthostatic hypotension, and with that in mind, we can say that the patient is predisposed to having what we call fall incident. Okay, so number two, based on that option, so let's discuss what is this confusion. So remember, in confusion, it is actually an immediate concern. Remember, confusion is an immediate concern because client may tend to get up with bed without supervision. So the client is confused, may get up on bed without supervision and experience an incident of fall. And remember, guys, when the patient had this fall, this is actually a sentinel event. So the gravity of fall depends upon how devastated the scenario was. So for example, the nurse forgets to increase the side rails or raise the side rails, and the nurse forget, for example, to keep the head of bed within the possible lowest height level. So let's say when the patient fell down and the head first fell on the ground. So possibly because of this scenario, the patient might uh, have another episode of stroke or what we call bleeding. So as I mentioned again, confusion is an immediate concern because the client may get up on bed without supervision and experience fall. Okay, so another idea that the patient had a previous fall history. So the patient has a previous fall history, and this is actually a major. So remember this, a major risk factor for additional fall. So we have to remember that any history of TIA or what we call transient ischemic attack is not actually an immediate concern. Okay, remember, history of transient ischemic attack is not an immediate concern. But for this reason, the nurse, so for this reason, the nurse has to the nurse has to monitor for possible indications of TIA. Okay, the nurse has to monitor for possible incident of TIA or stroke that is needed while the patient is in your skilled nursing facility. So, okay. So, with that in mind, so question number one for the drop down close, we answered the BP is very important, orthostatic hypertension. The patient is confused. So, the patient is predisposed to having a fall. And also, the previous fall history may somehow give you opportunity to identify that your patient is actually may gone to another episode of fall. So, very important that even if the patient had history of transient ischemic attack, the nurse should anticipate for possible signs and symptoms of reactivation of the TIA or what we call the stroke event. Okay? So, okay. So, ma'am, can you move? Okay. So, for the test taking tips here, guys, remember, so for the drop down close, so it is used to measure your multiple cognitive skills needed to make a clinical judgment. So, your drop down close, whether you are assess whether you are able to identify the relevant client findings that are of immediate concern to the nurse. So, what you're going to do is to for you to analyze this, to recognize, make use of this cues that is being provided to you, you can list down and organize these steps or these cues for you, and somehow identify whether it is a immediate concern or not a concern. So with this, again, let's have a recap. So an RR of 18 bits per minute, do you think it's a concern or not? Do you think? Okay, RR is a concern or not? Definitely, it's not a concern. For BP of 102/64 in sitting measurement, this is a immediate concern. Okay, a heart rate of 88, it's within normal limit. So meaning to say, it's not a concern. So confused at times since surgery, as we have mentioned, as we have discussed, it is an immediate concern. So transient history of transient ischemic attack, it's not a concern, but rather the nurse has to monitor for another episode of reactivation of PIA or stroke as mentioned. So next, admitted to PT, occupational therapy, after a total knee amputation. Do you think it's an immediate concern or not a concern this time? So it's not a concern as well. The patient fell yesterday. It's actually a immediate concern. Alert and oriented is not a concern. So you put here an X, okay? Incontinent of urine. They think incontinent of urine is an immediate concern or not a concern. Okay, correct. It's not a concern. So remember that urinary incontinent is also a risk factor for fall. Remember that. It's also a risk factor for fall, but it's not an important as fall history. So based on the informations also provided, the patient is alert and oriented 3 times. So even if the patient is incontinent of urine, the patient can obey commands. So the patient can obey or can follow the instruction given by the nurse because he is alert and oriented. Therefore, incontinence of urine is not a concern at this time. Okay? So now let's move on to number 2 question. So number 2 is all about analyzing cues. Okay, can we now move on, Ma'am Melanie? Okay. So in analyze cues, nurses, you have to ask yourself, what does it mean? From the cues that was presented to me, what does it mean? So how should I utilize these cues in order for me to effectively manage my patient? So with this example, with this level, I intend to give you an example about the matrix multiple response question. Okay, so what is this multiple matrix response question? Later on, we will be discussing that. So what is this scenario? So a 96-year-old client with COPD was admitted to the medical surgical unit from the emergency department with complaints of increased shortness of breath, cough, heart palpitation, and more mucus production than normal. So you will be again presented with several tabs. Remember, the key in order for you to understand the whole scenario is please take time to open all the tabs. Okay, remember all the tabs there, informations for you to be able to analyze, for you to be able to understand the cues, the condition of the patient. So please be certain to open all the tabs that's being provided to you in order for you to understand the condition or the client's condition. So let's now go ahead, read the health history. So the health history of the patient is a known diabetes, and the patient is COPD patient, okay? Chronic obstructive pulmonary disease patient. So the patient is taking these medications, theophylline, short and long-acting beta adrenergic agonists. So the patient also taking high-dose inhaled corticosteroid, prednisone, insulin glargine, and insulin as part of his treatment medication. So let's go ahead read the nurse's notes. In 1400, the patient color is pale, coughing and expectorating yellow-colored sputum, and complaining of chest tightness. Lung sounds reveal wheezing, and diminished breath sounds bilaterally. So the point of care result, the blood glucose is 295 milligrams per deciliter or 16.8 millimole per liter. The vital signs are the following. So temperature, 101.8 degrees Fahrenheit, or it's obvious that the patient is having fever of 38.8 degrees centigrade with an apical heart rate of 120 beats per minute and regular. So blood pressure is normal. So 128 over 80 millimeters per mercury and RR of 20 beats per minute. It seems to be normal. However, the oxygen saturation is seems at 88% on room air. So oxygen saturation is 88% on room air. Okay, can we now move on to the next slide, please, ma'am? Okay, so the question here is for each assessment finding below, click to specify if the finding is consistent with COPD exacerbation, pneumonia, or adverse effect medications. So each assessment finding may support one or more condition. Okay, so in this time, you can select any one, you can select two, or even you can select three, as long as the condition or the signs and symptoms is applicable with the given condition. So let's go ahead and identify whether the assessment finding increased shortness of breath, okay, is consistent with COPD exacerbation. Do you think increased shortness of breath is consistent to COPD exacerbation? Yes or no? Do you think? Okay, do you think that COPD exacerbation is consistent with increased shortness of breath? Okay, thank you, Miss Jen Berung, yes. Tintin, Miss Peruco, and Miss Romanica, yes, yes, correct. So put an X here. Do you think pneumonia? Do you think in case of pneumonia, is there also a increased shortness of breath in pneumonia? Yes or no? Do you think pneumonia, there is also an increased shortness of breath? Correct. So put an X here as well. Do you think increased shortness of breath is an adverse effects of that medication? Do you think? For me, I find it no. So let's move on with cough. In cough, do you think COPD exacerbation, the patient will present with cough? Yes or no? I think it's yes as well. And pneumonia, do you think cough? Okay. In pneumonia, is there a cough in pneumonia? Yes or no? Okay. Is there a cough in pneumonia? Yes or no, guys? Yes. Let me repeat my question. Is there a cough in COPD exacerbation? Yes or no? Yes. Okay. For COPD, correct. So let's now move on to increased mucus production. Do you think increased mucus production, okay, can be seen to patient with COPD exacerbation? Yes or no? I think yes, correct. Pneumonia, okay? Can that be seen as well? Correct. Thank you so much, Miss Romanica and Miss Katie. Correct. What about for heart palpitation? Do you think in COPD and pneumonia, is there a heart palpitation there? Yes or no? Is that consistent with that? I think no. Palpitation cannot be seen in COPD or pneumonia, but that is an adverse reaction of medication. So put an X here, and blood glucose of 295 milligrams per deciliter. Do you think a patient with COPD can present a high blood glucose? Yes or no? Do you think a patient with COPD exacerbation, can a patient increase his or her blood glucose 295? Guys, do you think yes or no? Okay, the answer there is yes, actually. Later on, we will rationalize why is it in COPD there is an increased blood glucose level. Do you think in pneumonia, is there a increase blood glucose in pneumonia? Yes, definitely. In adverse effect of medication, do you think there is an adverse effect? Guys, remember, based on the presentation of the patient, remember that your patient is taking corticosteroid. Your patient is also taking prednisone. Your patient is also taking insulin glargine and insulin aspart because the patient is a known diabetic. So elevated glucose can be seen to all circumstances, COPD, pneumonia, and adverse effect of medication. Yes, definitely because of steroids. Okay, let's now move on with fever. Do you think in COPD exacerbation there is a fever? Yes or no? I think no. In pneumonia, so we believe that pneumonia is a infection. Definitely sign of infection is fever. Okay, adverse effect of medication, do you think? No. There's no such thing as fever in adverse effect of medication. SpO2 of 88% on room air, do you think in COPD exacerbation? Okay, can that be seen? Yes. In pneumonia can also be seen. In pneumonia, SpO2, 88% of room air. Do you think it can be seen as well with pneumonia? Definitely, because what happens during pneumonia, there is a poor oxygen perfusion. So if there is a poor oxygen perfusion, so meaning to say, okay, that the oxygen saturation, SpO2 is definitely decreased. So let's now go ahead and discuss the rationale. Okay. So remember guys, okay, remember. So there are usual manifestations of COPD exacerbations. So what are the manifestations of COPD exacerbation? One, the patient might be having increased coughing. So here, might be increased coughing. The patient might presented with wheezing. The patient has presented with more shortness of breath. Okay, more shortness of breath than usual. Okay, so other signs and symptoms, other manifestations of COPD exacerbations. Number one, the color may changes. So what is the problem with COPD patient? They have problems for so long with oxygenation. So probably they will be presented with, they will be presented as pale. Their color is pale. Okay? So thickness as well, or also the amount of mucus. So unusual amount of mucus. Okay. So remember as well in some COPD, okay, in some COPD patient, the SpO2 of 88%, okay, can be normal or can be indicated to a COPD exacerbation. What about for pneumonia? So remember in pneumonia, there is a fever. Okay, there is a fever, a cough. So meron kayong cough and also mucus production. There is shortness of breath and the SpO2 could be lower due to compromise, okay? Due to compromise respiratory status. As I've mentioned, the problem with pneumonia is poor perfusion, okay? Okay? There is a mismatch with the perfusion of oxygen and carbon dioxide that leads to compromised respiratory status. Okay. Another characteristic of pneumonia in terms of pain, your patient is experiencing sharp or stabbing pain. Okay. So sharp or stabbing pain, which is also a characteristic of pneumonia. So what about for this glucose level? Okay. So remember guys, remember your patient has infection as evidenced by temperature of 38.8 degrees centigrade. Remember guys, during infection, remember infection or your infection increases the glucose level. Okay? So the answer here, your glucose level increases in the presence of infection. Okay? Due to, okay, due to, ano daw nangyari? So due to the body's response, okay? Due to the body's response to amount of certain hormones. So response of the bodies in terms of the certain hormones. So what are these hormones that are evident during infection? That is significantly increased. okay, during infection. One is your cortisol, and the other one is adrenaline. So cortisol and adrenaline, okay, leads to body's increased production of glucose. And from the history itself, we already established that your patient is taking prednisolone or and corticosteroid. This can also increase the blood glucose by making the liver resistant to the insulin. So remember this rationale. Okay, what about for this theophylline? What is this theophylline? Theophylline is a bronchodilator. So what matters most is when our patient takes this theophylline, the nurse should be able to anticipate that in theophylline, there is such thing as signs and symptoms of theophylline toxicity. So when the patient is a long-term theophylline user, so the nurse should be able to anticipate the signs and symptoms of theophylline toxicity. So what are the examples of signs and symptoms of theophylline toxicity? Does anyone from the group can share their knowledge about the signs and symptoms of theophylline toxicity? Number one, NA, that is your nausea. Okay, nausea, vomiting, abdominal pain. We also have tachycardia. We have the muscle tremor and your heart palpitations. So remember that heart palpitation is also a sign of toxicity. Okay, let me repeat again. Nausea, vomiting, okay, abdominal pain, tachycardia, muscle tremor, and your heart palpitations are also signs of toxicity. Okay, signs of your toxicity. So, okay, so for the next slide, we also have this test taking tips. So, what are these test taking tips? As I mentioned a while ago, so increased shortness of breath, this is related to added stress on the respiratory system. So in pneumonia, it is also same. So adverse effect of increased shortness of breath is not specifically related. For the cough, that is related to the chronic manifestations of COPD that is being worsened, especially in exacerbation. And for pneumonia, cough is also related as acute manifestations of respiratory infection. So adverse reaction, not related. Cough is not related to adverse reaction of medication. For increased mucus production, same as above, it's related to a chronic manifestations of COPD, especially during exacerbation. And for pneumonia is also related to manifestations of respiratory infection. What about for your heart palpitation? In COPD and pneumonia, there's no such thing as heart palpitation, but heart palpitation can be an adverse effect of medications, especially the patient is treated with theophylline. So remember to anticipate the signs and symptoms of theophylline toxicity. Okay, such as nausea, vomiting, abdominal pain, muscle tremor. Okay, heart palpitations as well. Okay, so blood glucose level, as we have mentioned, 295, especially during episode of stress and infection. There is a significant increase in blood glucose. Okay, so it is also important that the nurse should titrate the insulin level and make a appropriate adjustment should the patient becomes especially resistant to the treatment. So in COPD exacerbation, because your patient is taking prednisolone and corticosteroid, okay, so patient with COPD can have a increased blood glucose due to high dose of inhaled and oral corticosteroids therapy. Okay. So in pneumonia, there is also a manifestations of infection. So therefore, it is expected that the blood glucose will also increase. And as we have already mentioned, your patient is taking prednisolone, so definitely the glucose level will also increases. Okay, what about for your fever? As I mentioned a while ago, COPD exacerbation, fever is unrelated. But in pneumonia, as we all know, fever is the sign of infection. So definitely it is common that a patient with pneumonia should present with fever. It is related as a manifestation of respiratory infection. So for your adverse effect of medication, it's not related. For SpO2 of 88% on room air, it is related to chronic manifestations of COPD and worsening exacerbation, pneumonia because of respiratory infection, and unrelated with the medication. So there's no such thing as a medication that can decrease significantly the SpO2. Okay. So now, let's move on to now question number 3, prioritize hypothesis. So in prioritize hypothesis, where do I start? Ask yourself, where do I start? Based on the recognizing cues, based on the analyzing cues. So this time, I'm going to give you example about multiple response or multiple response select all that apply question. So let me go ahead, read the scenario. What is the scenario? A 22-year-old client is brought to the emergency department by emergency medical service. The client parent found that the client slumped over and unconscious. The client was seated in the wheelchair eating breakfast when the parent last saw the client 15 minutes prior. The client was bleeding profusely from both wrists, and the parent reports immediately placing pressure on both wrists and screaming to the spouse for help and to call emergency medical system. At the scene, EMS reports that the client was unconscious, but the bleeding was controlled, okay, and pressure dressing and continuous pressure to both wrists were maintained. So EMS reports that the client BP was somehow um, decreased by 98 over 60 millimeters mercury, apical heart rate of 120 beats per minute, RR of 16. So oxygen at 3 liters per minute by nasal cannula was administered and the IV line was inserted. Okay, an infusion of LR was initiated and the client was transferred to the emergency department. So on arrival at the emergency department, the client is arousable but sleepy. So assessment and treatment are immediately initiated and the client is stabilized and admitted to the hospital. The admission nurse reviews the medical records, performs an assessment and documents in the nurse's notes. So let's go ahead, read the tab about the health history and vital signs. Okay, so for the health history, for the next slide, okay, so we have for the next slide this health history. This 22-year-old, okay, ma'am, Melanie, can we now move on our slide? Okay, for the health history, this 22-year-old client sustained a spinal cord injury in the lower thoracic region, 1 year from a motor vehicular crash. The client has a paraplegia and no other medical problems. So remember, 22-year-old, the client sustained a spinal cord injury into the lower thoracic region a year ago from a motor vehicular crash. And because of that, the client had a paraplegia and no other medical problems given. So, what are the signs, the vital signs? So, temperature of 101, the client has a fever because of 38.3 degrees centigrade, the heart rate of 96 beats per minute, BP of 116 over 78 millimeters mercury, RR of 20 beats per minute, and oxygen or SpO2 is normal at 94% on room air, and wrist pain of 4 over 10. Okay, so what is this nurse's notes all about? Okay, the nurse's notes. So the client is alert and oriented. Okay, is sleepy but easily arousable, states is sick and tired of living this way and is too young to have to be in wheelchair for the rest of my life. So here, so upon reading this statement from the patient, somehow some of you might formulate, okay, about the possible diagnosis for this patient. States, "It is my own fault that I am this way. I am so sorry that they found me this morning. I slashed my wrist using my breakfast knife. I am so useless and do nothing right, even with trying to kill myself." The patient has no appetite and is refusing to eat. States wants to sleep and not be bothered by anyone. Dressing on both wrists are dry and intact. No redness or break in skin integrity noted in other skin areas. No sensation fell in lower extremities. Unable to move lower extremities. Last bowel movement 1 day ago. Bowel sounds presents in all four quadrants. This is normal. So abdomen is firm, urinary output of 200 ml in the emergency department via catheterization, but she states she needs to self-catheterize every 6 hours depending on intake. So on no respiratory distress because RR is normal at 20, 94% on room air, 4/10 in wrist pain and pain medication administered in the emergency department 2 hours ago, and there's no chest pain and the pulse seem to be normal at 96 beats per minute. So let's now go ahead and read the laboratory results. So I am injecting this. I am over and over telling you guys when you will be presented with different tabs, please go ahead, read all these tabs because all answers are already on the tab. You just have to read it and analyze it, okay? And try to connect those informations, those data with regards to the presentation of the patient. So again, very important to read all the tabs and please avoid skimming. Okay? So please avoid skimming. So let's now move. Okay. So what is good about the NGN? They will be giving you also the reference range. So you don't have to memorize the reference range. You just have to compare it whether it is within the normal limits. So for the test of RBC, 4.7 times 10. So the normal is 4.2 to 6.2. So in WBC, 12,000 millimeter. Okay? So 5,000 to 10,000 millimeters squared is the normal. So with that, I can say with the RBC here of 4.7, the result of the patient based on the normal reference, this is normal. Now, let's move on with WBC. Your patient has obtained a 12,000 millimeters So as compared that to normal reference range, do you think that is normal? Yes or no? Do you think that is normal? 150,000 to 400,000. Do you think that is normal? Yes or no? Okay? That is not normal. WBC is high. Remember, WBC is high. Platelets, okay, 160,000. So normal reference range is 150,000. This is normal, yes or no? Is that normal, 160,000? 150,000 to 400,000 is the normal range. Is that normal, guys? Platelets? Okay, guys? Yes, it's not normal. WBC is not normal. But the question here is platelets 160,000. Do you think it's normal? Yes, it is within the normal limits because the normal limits is 150 to 400,000. What about for hemoglobin? Hemoglobin of 14 grams per deciliter. Do you think that is normal? It is actually normal based on the normal reference range of 12 to 18. And hematocrit of 42%. Do you think that's normal? It's also normal because the reference range is 37 to 52%. So based on this laboratory result, we already established that the patient has a significant increase in WBC. So the WBC is high. So what is now the question? Based on this presentation of the data. So let's now move on with the question. Okay, what is the question? So which of the following, okay, are the priority client's needs of immediate concern? So I intend, guys, again, to highlight priority and immediate concern with red so that you will be able to anticipate, okay, the anticipate what is really asking. The stem of the question is to identify the priority needs of immediate concern. So select all that apply. So let's now analyze. Okay. So we have here pain, appetite, infection, bleeding, paraplegia, suicide risk, and urinary output. Can somebody, can someone from the group answer, can select answer for this question? So which of the following are the priority clients' needs of immediate concern based on the presentation? Do you think? Do you think we can select here pain? Guys, do you think we can select here pain? I think this time is not a priority. Do you think we can also select appetite here? Guys, do you think we can also select appetite here as a priority or immediate concern? I think no. Do you think infection? Do you think infection might be a priority needs for of immediate concern? Yes or no? Do you think infection, bleeding, infection, suicide risk? Okay, bleeding, infection, suicide risk. Okay, so thank you for your answer, Romanica. Appetite, no. Very good. Yes for infection. Correct. Miss Jen, Miss Tintin. Yes for infection. So, no for pain. Not this time for appetite is also no. Infection, yes. Bleeding. Do you think bleeding here is a priority needs of the immediate concern? Do you think bleeding, guys, here is priority? Remember, going back with the presentation of the client here states, okay. So let me read again. So here, going back, in emergency, EMS reports that the client was unconscious but the bleeding was controlled. Remember, the bleeding was controlled and pressure dressing and continuous pressure to both wrists were maintained. Were maintained. So another thing here with the nurse's notes. Okay? Another here with the nurse's notes. Let me check also. There's no such thing as bleeding issue with the nurse's notes. Okay, so let's now move on. So bleeding, it can be question mark this time. Later on, we will rationalize. Paraplegia. Do you think paraplegia might be a priority concern with this? I think it's not because paraplegia is a long-term problem. It is already existent even before the patient committed suicide. Okay. Do you think paraplegia, Miss Yolanda, is a priority concern based on the presentation of the patient? I think this time is no, but later we will establish why is it. Is it this time no? Okay, suicide risk. Do you think suicide risk is a priority concern? Yes or no? Suicide risk? Do you think? No, very good. Miss Tintin Perucho, suicide definitely correct, Ma'am Yolanda. Miss Romanica, do you think suicide risk? Do you think suicide risk is priority this time? Definitely. Thank you for your answer, Mark Andre. Jerby Room is also yes. What about for urinary output? Do you think urinary output is priority at this time? Okay, do you think urinary output is priority at this time for your client? I think it's also no. I think it's also no. So based on this, 1, 2, 3, 4, 5, 6, 7 options for select all that apply question, I think the answer is only infection and suicide risk as priority clients need for immediate concern. So let us now establish why is it that is the correct answer. Okay. So remember guys, remember as I mentioned, ma'am, can we now move on for the rationale? So, okay, next slide, please. Okay. Okay. So remember, suicide risk, okay, remember that is an immediate priority. So it is defined as a completed suicide. It is an act of intentional ending one's own life, self-inflicted, and life-threatening attempts but not necessarily it leads to death. Remember. So there are risk factors that we have to establish. What are the patients, or who are the patients that is predisposed to suicide risk? So number one, so we have your chronic medical conditions. So is it your patient has a chronic medical conditions? Yes, paraplegia, because based on the history, the patient sustained a traumatic vehicular accident that affected her thoracic spine. Okay, so your patient has a paraplegia, so definitely a chronic medical condition, okay, affects person's life ability. Number second factor, previous attempt. Client with spinal cord injury with resultant paraplegia. So she has, or the client may have significant behavior and emotional reactions as a result of changes in her functional ability, body image, and also role performance, and also the way she look on her self concept. Okay, so what do you think the client's needs at this point? So the client should assess, okay, the nurse should assess client's needs for the reaction. Okay, the client's needs for the reaction to injury, and you should offer hope, and you should also offer encouragement for this matter. Okay, so next, infection is also a priority. Okay, temperature is elevated, okay, as justified by increased WBC. Okay, WBC based on the laboratory result is high. So do you think pain this time is immediate concern? Pain is not concern since she was medicated already. The patient is medicated already 2 hours ago in emergency department. So it's not anymore a concern this time. But as the nurse should continue to monitor the pain status. Remember that. It's not a immediate concern at this time, but the nurse should continue to monitor for pain status. Next, appetite is indeed also not a priority. Although, although the nurse again should monitor appetite status and nutritional intake because this seems to be important. Okay. Nutritional intake and appetite status is also important. Next, bleeding. So bleeding has been controlled already. That's why we do not select bleeding because it was stated already that the bleeding is controlled and the dressings are dry and intact. Okay. So there's no such thing as indication that the bleeding is ongoing because bleeding, as long as the dressing is dry and intact, so it means to say that the bleeding is stopped. And the laboratories presented a while ago are within normal limits. Okay? We already established that laboratories are within normal limits except for the WBCs. Number 7, paraplegia. Remember that your paraplegia is a chronic condition or problem, but the nurse should plan to address your paraplegia at a later time, not this time. So the nurse can synchronize, can collaborate with occupational therapies or also physical therapies, but not this time because again infection and suicide risk are important uh, um, uh, uh, things that the nurse should focus. What about for urinary output? So urinary output, the nurse should monitor the client. Okay, as stated a while ago, your client requires intermittent catheterization depending on the amount of water or the intake she has. But remember, during in the emergency department, okay, it was stated there that the patient had 200 ml of urine. So meaning to say the patient doesn't have problem with urinary output. So with that in mind, we cannot also include that urinary output is something that the nurse has to be concerned about this time. So the only answer there is suicide risk and infection. Okay, so again for the test taking strategy, so you try to begin answering question by thinking about which client needs noted in the question with respect to the immediate safety implication. So based on this, let's try again. Okay, let's try again putting it into a table so that let's identify whether this is a safety implication or something with supporting evidence. So pain, do you think pain is an immediate safety implication? Definitely no, but it has a supporting evidence, 4/10. Appetite, it's not also a safety concern. Okay, it has a supporting evidence there. The patient doesn't have any appetite, so she doesn't want to eat. Okay, is infection an immediate safety implication? Is also yes. Is there any supporting evidence as stated in the history? It's also yes. Bleeding? Yes, definitely. Okay, it's an immediate safety implication. So, but the problem is why is it we excluded bleeding here? Because in supporting evidence, there is no information that tells that there is an active bleeding because the dressing is dry and intact. Okay? The dressing is dry and intact. So meaning to say bleeding at this time is not a priority. Okay, paraplegia, it is a safety implication. Okay? Do you think paraplegia is an immediate safety implication? Definitely no. Is there any supporting evidence that states that paraplegia should be a top priority? It's also no. What about for suicide risk? Definitely is an immediate safety implication. The patient used her knife to cut off her wrist. Is there a supporting evidence? Yes, because the patient has been rushed in the emergency department. It's unconscious, and there is a evidence bleeding. Okay, and the BP somehow not within normal limits. So urinary output. So is that an immediate safety implication? Definitely no, because the patient had 200 ml of urine in the emergency department. Is there a supporting evidence that states that urinary output should be a top priority? Yes, definitely, because it was state there. The patient requires a intermittent urinary catheterization. So this time, guys, these are the tips to be able for you to answer this correctly. So remember, for this immediate safety implication plus a supporting evidence, if both remember this, if both immediate safety implications plus there is a supporting evidence that are present within the given information, so definitely these are the correct answer. These are the correct answer and these are priority. However, okay, if there is no immediate concern, safety concern, and there is no supporting evidence, you can eliminate it right away. Eliminate it. That is the tip. On the other way around, if the option would be considered as an immediate safety implication, but there's no supporting evidence, you can also eliminate that. Okay? So, in other words, if both safety implication and there is a supporting evidence, that is the correct answer. If there is only immediate safety implication and no supporting evidence, that is not the answer. Eliminate that. Okay. There is a supporting evidence but no immediate safety implication, you can even eliminate that. So, meaning to say for this type of question, both immediate safety implication and supporting evidence should be simultaneously present. Okay, for you to be able to select it. Number 4. So number 4, or generate solutions. So we have your matrix multiple choice. Okay, what should you do? What can I do as a nurse for this? So let's now move on to number 4, or step 4, scenario. So the scenario goes like this. The client who is 5 days post-operative following a right colectomy to remove a bowel tumor calls the nurse and states that they felt a popping sensation in the incision after an episode of forceful coughing. So the nurse removes the abdominal dressing and notes that the incision has opened. wound layers are separated and the portion of the bowel is protruding from the wound. So here, we can use the word colectomy. So how do we define colectomy? So colectomy is defined as any procedure that removes all the part of your colon or your bowel. So based on this, the patient had an episode of forceful coughing, and somehow there is a popping sensation in the incision. So somehow the patient might had a episode of what? Is it evisceration or dehiscence? The patient had evisceration. Okay, so what is the question now? So what is your task for your generate solution? Matrix multiple choice. So place an X to indicate, okay, so place an X to indicate whether each, Mamel, can you move the slides? Okay, so place an X. Okay, I think it's not moving. Mamel? Mamel, can we move the slides next? Okay, so place an X to indicate whether each potential intervention listed below is either indicated or appropriate or necessary or contraindicated, could be harmful or unsuitable to the plan of care per client at this time. Okay, so sabi ko kanina, as I mentioned a while ago, your patient had evisceration. So now our task is to identify whether these interventions listed can be indicated or contraindicated based on the scenario. So place the client with the head and body flat and with the hips and knees bent. Do you think that is indicated or contraindicated? Placing the client with the head and body flat and with the hips and knees bent. That is contraindicated. Later on, we will rationalize why is it. Next, place a sterile warm area or warm saline rather, soak dressing over the open wound. Is that indicated? Place a sterile warm saline soak dressing over an open wound. Is that indicated? Saline warm soak dressing over an open wound. Do you think that is indicated or contraindicated? Guys, okay? So so it's up to you later. We will rationalize that. So is it placing a sterile warm saline soaked dressing over the open wound? 3. Don sterile gloves and gently reinsert the protruding bowel into the wound. Do you think that is indicated or contraindicated? Provide the client with small amounts of water or juice to stay hydrated. Is that indicated or contraindicated? Notify the surgeon. Do you think that is indicated? Yes or no? Prepare the client for surgery. Do you think that is indicated or no? Or last, assess vital signs every 10 minutes. Do you think that is indicated? Yes or no? Now let's move on to rationale. So let's now explore the answer. Okay. So as I mentioned a while ago, evisceration. We define evisceration as a total separation. So total separation of wound layers and the protrusion of intestinal organs outside through the wound. So this is usually it happens between 5th and 10 days after the surgery. And evisceration can be common to the following condition. So evisceration can be common to the following condition. Number one, if the patient is a known diabetes, okay, has diabetes mellitus, the patient is malnourished, the patient has a immune deficiency, or the patient is taking steroids, okay, medication. Why? Because diabetes, malnutrition, immune deficiency, and use of of steroid medication may somehow delays the healing process. Okay, it delays the healing process. Okay, so remember that your evisceration is a surgical emergency. So when that happens, the nurse has to stay. The nurse has to stay, and you should call another nurse to notify the surgeon. And since that is an emergency situation, it is also imperative that you call the rapid response team immediately and bring the supplies needed as necessary. So while you are there on the patients, one, you should provide reassurance. You should provide reassurance and position the client immediately in supine. Okay, remember this. Position the client in supine with the hips and knees bent and with the head of bed elevated at least 15 to 20 degrees. This prevents stretching of the abdominal tissues and prevent pressure on the incision line, which would worsen the condition. Using the sterile technique, yes, it's correct. You should apply 1 to 2 large abdominal dressing to put it in the area, but prior doing that, you should be able to saturate it first with warm. That is correct. So therefore, saturate it with warm, normal saline to the wound. Why? This is to prevent hypothermia. Okay, this is to prevent, that is the important thing to remember, saturating it with warm saline water to prevent hypothermia and provide moisture barrier to the tissue and protruding organ. Okay, why is it become again warm? Because we really want to prevent hypothermia to happen. And you should not attempt, remember this, you should not attempt to reinsert the protruding organ. Okay? The protruding organ because it might cause trauma to the patient. This might cause trauma to the patient. And always monitor vital signs every 5 to 15 minutes. Remember this? Monitor vital signs for every 5 to 15 minutes until the surgeon comes or arrives. And please be certain to monitor for signs of shock. Okay? Monitor for signs of shock. Okay? So what is the signs of shock? Hypo-tachy-tachy. Okay. Place the client in NPO to decrease the risk of aspiration if surgery is necessary. Remember that. Okay. So next test taking strategies. Okay, ma'am. For the test taking strategies, place the client with the head and body flat and within the hips and knees bent. No, because this may cause further tissue disruption from pressure on the incision line. Placing a sterile warm saline soak, okay, dressing over the open wound. This is yes to prevent hypothermia and provide moisture to affected area. Donning of sterile gloves and gently reinsert the protruding bowel into the wound is no, because you might reintroduce or introduce trauma to the patient. Providing the client with small amount of water or juice to stay hydrated is always no, because you have to put your patient to NPO should surgery necessitate, okay, to prevent the risk of aspiration. You should notify the surgeon. This is definitely yes. And the nurse should be able to anticipate additional orders that the doctor should ask and also determine the details about the surgery if surgery is going to happen. And prepare the clients for surgery, definitely yes. This could repair the surgical site, and assessment of the vital signs every 10 minutes is yes, especially important in monitoring for signs and symptoms of shock. So what is again the signs and symptoms of shock? Hypo-tachy-tachy. Okay, so now let's move on. So take number 5 is your take actions or your matrix multiple response. So what will I do? So the scenario is a 65-year-old client was hospitalized and treated with symptoms of heart palpitations and extreme shortness of breath. On admission, diagnosis studies showed the following. So the patient had atrial fibrillation, CT revealed negative for embolism, and chest X-ray revealed enlarged left ventricle. So the nurse is preparing for the client for discharge and provide teaching about prescribed medications. So for each medication listed, click in the box to specify the teaching point the nurse would provide to the client, each teaching point may support more than one medication. So, can we now move on, ma'am? Next slide, please. Okay. So for each medication listed, click in the box to specify the teaching point the nurse would provide to the client. Each teaching point may support more than one medication. Okay. So now we have here three medications. We have amiodarone, metoprolol, and warfarin. So let's now focus on the teaching point, whether this is applicable to any of the medications stated. So uh, yes. Routine laboratory monitoring. Do you think that is applicable for amiodarone and metoprolol? I think that is only applicable for warfarin. So monitor and report signs of bleeding. I think that is also the teaching point for warfarin and not for amiodarone and metoprolol. Monitor and report shortness of breath. It's not also teaching point for amiodarone and metoprolol. But monitor and report for shortness of breath is not a teaching point for warfarin, but rather a teaching point for amiodarone and metoprolol. Monitor BP and heart rate. Okay. That is a teaching point for amiodarone and metoprolol, but not for warfarin. And consume consistent amount of green leafy vegetable is not a teaching point for amiodarone and metoprolol, but rather a teaching point for warfarin. So let's now move on with the rationale. Remember that your in rationale, amiodarone is an antidysrhythmic. Okay, is an antidysrhythmic medication used to treat atrial fibrillation. So it causes blood vessels dilation. Remember that amiodarone causes blood vessels dilation and can lead to D for dizziness and hypotension. Amiodarone can cause dilation of the vessel, thus could lead to dizziness and hypotension. So whenever the patient is taking amiodarone, you should teach your client to check his or her heart rate. Remember, checking for the heart rate and blood pressure. Okay, blood pressure. Because the adverse effect is usually pulmonary toxicity. So what should the nurse anticipate if there will be a pulmonary toxicity? If there is shortness of breath, okay, if there is here shortness of breath, the nurse has to call the physician or the caregiver immediately. Okay, remember this. Next, metoprolol. Metoprolol is your beta-adrenergic blocker. Your metoprolol is your beta-adrenergic blocker and cause your heart rate and BP to decrease. So remember, your metoprolol is a beta-adrenergic blocker and causes your heart rate and BP to decrease. So each time your patient is taking metoprolol, the nurse should make sure to teach the client that heart rate and blood pressure are within normal limits. Are within normal limits as it may cause, okay, as it may cause shortness of breath, okay? It also causes shortness of breath, coughing, and also wheezing. So if you see coughing, shortness of breath, and wheezing to patient who is taking metoprolol, please notify the physician immediately. Okay. Please also remember that both amiodarone and metoprolol clients should be taught, okay, should be taught safety measures. Clients should be taught safety measures such as moving slowly from sitting or lying to a standing position. Okay, to a standing position. And immediately, if the patient, okay, and if the patient feel somehow dizziness, the patient or lightheadedness, for example, the patient has to immediately sit down or lie down. Okay, remember that. sit down or lie down during dizziness or lightheadedness. And warfarin, so Coumadin. So normal Coumadin, so we have zero point 0.9 to 1.8 per second. So we have the therapeutic of up to 3 times. So bleeding tendencies if the result is more than 3.5 seconds. Okay? So remember that an anticoagulant requires routine laboratory monitoring for coagulation studies, especially INR, or what we call international normalized ratio, and the dose adjustment are made based on the INR. Okay. So another points to remember with your warfarin slows down clotting, and the adverse effect is bleeding. Then monitor and report, definitely. The nurse should monitor and report signs of bleeding. So green leafy vegetable contains vitamin K, which is an antidote for warfarin. So meaning to say, you have to be certain as well that when your patient is taking warfarin, the since or taking warfarin and he or she is eating green leafy vegetable, as we all know, your green leafy vegetable contains vitamin K. It is a must to remember and to explain to our patient that the patient should only consume a consistent amount of green leafy vegetable, so the vitamin K from this food remains at a consistent level, remains at the consistent level in the body and does not inhibit the effect of warfarin. Okay, so now move on. So let's now move on with taking tips. Okay, there you go. So warfarin is an anticoagulant, is a long-term prophylaxis of thrombosis. What is the side effect of your warfarin? B stands for bleeding. So what is your primary nursing consideration or teaching points? You need to do a multiple drug-to-drug. It may cause multiple drug-to-drug interaction or food interaction. So the nurse should perform medication reconciliation. The nurse should review diet, monitor bleeding, monitor for signs of bruising, for example, urine, stool, and safety measure. For example, the nurse has to tell the patient to use only soft bristle toothbrush and use of a electric shaver when shaving because having these bleeding tendencies. So amiodarone is a treatment of choice for atrial and ventricular dysrhythmias. Atrial and ventricular dysrhythmias with the side effect of pulmonary, cardiac, and thyroid toxicity and photosensitivity, as part of the ophthalmic effects. So what are the primary nursing consideration? Monitor signs and symptoms of toxicity, measure heart rate and BP, report lightheadedness or dizziness. Okay. So last one, we have your metoprolol. We already established that this is a beta adrenergic blocker. So what are the indications of metoprolol? We give metoprolol to patients with hypertension, patients with angina, patients with heart failure, and patients with myocardial infarction. What are the side effects of your metoprolol? Bradycardia, reduced cardiac output, heart block, rebound, and cardiac excitation. And the nurse has to monitor the following: measure the heart rate and BP, measure and report immediately. Tell your patient if he or she is having these adverse effects such as lightheadedness, dizziness, cough, and wheezing, because that necessitates information that the doctor should know, okay, because that is a toxicity. Okay, so next. So last question would be evaluate outcomes. So in evaluate outcomes, so we have here the highlight text example. So scenario would be a 3-year-old newborn is seen in the outpatient pediatric clinic for a post-hospital follow-up appointment. So the nurse reviews the health history and notes the following. So the infant born full-term via vaginal delivery, no labor or birth complications. So the birth weight is 7 pounds or 3 ounce or 3.3 kilograms. The birth length is 19 inches. So laboratory revealed that bilirubin is 3.1 milligram per deciliter as compared with the normal reference value. It seems that the result is a little bit high, is obviously high, okay? 3.1 or 52.7. So next, so the question here is, the nurse performs an assessment on the newborn and obtains a blood specimen for evaluation of the bilirubin level. So the following notes are documented. So your task is to click to highlight the findings that indicate the need for follow-up in a 3-day-old newborn. So again, as I mentioned a while ago, very essential thing to remember when you will be presented with different tabs. So please take time to read all the information in all tabs because the answers are there already. Okay, so nurses notes, breastfeeding, chest feeding, okay, every 2 to 3 hours without difficulty. Parents report infants urinate 12 to 15 times per day and has a bowel movement of 5 to 6 times per day. So they report that the stool is greenish brown to yellowish brown, thin and less sticky in consistency than it has been. They have noticed that the skin looks tan and the eyes looks yellow. So the vital signs revealed 99.6 degrees Fahrenheit or 37.5 degrees Celsius for axillary, apical heart rate of 180 beats per minute, and regular RR of 170 beats per minute, and the weight is 7 pounds or 5 ounce or 3.4 kilograms. So the bilirubin here, okay, so the bilirubin seems to be high, okay, because 4.8 milligrams per deciliter is the result, and according to normal reference range, the normal is only 0.2 to 1.4 milligrams per deciliter. So based on this, so our task is to highlight the findings. So based on the nurse's notes, okay, we can highlight here, they have noticed this the skin looks tan and the eyes look yellow. So we can highlight that in the nurse's notes. Okay? What about for your vital signs? 37 degrees Fahrenheit, zero point 0.5 degrees Fahrenheit is not normal. The patient is somehow febrile. Okay? The patient has a feverish or has a fever. Okay? The apical pulse is 180. Okay? 180 beats per minute. So we can even highlight that and also highlight this bilirubin result of 4.8. So next. So rationale. So let's now move on to the rationale. So remember, this unconjugated bilirubin. Remember guys, unconjugated bilirubin normal is 0.2 to 1.4 milligrams per deciliter. This is basically a pigment that is increased mostly in infants with neonatal jaundice. It is the bilirubin associated with normal destruction of older red blood cell, and thus we call it as physiologic jaundice. Remember with unconjugated bilirubin that high levels of unconjugated bilirubin can result in damage to the basal ganglia in the brain, thus causing kernicterus and damage to the 8th cranial nerve, resulting to sensory neural hearing loss. So it is important again to remember that the normal values of unconjugated bilirubin and the damage it can cause to basal ganglia to a patient with physiologic jaundice. If exceeded at 5 milligrams per deciliter, it is called a jaundice. And jaundice can be physiologic and it could be pathologic. So remember, with physiologic jaundice, it doesn't present on day one. But in pathologic jaundice, it presents during the first day of life, which is an abnormal finding and should raise concern and always require further evaluation. So hyperbilirubinemia is the condition where your patient is currently having. This occurs when excessive amount of bilirubin accumulates in the blood, as evidenced by mild and self-limited physiologic jaundice, or also known as your icterus neonatorum. So let's go ahead, analyze the following information. Do you think tan-colored skin and yellow eyes are not expected? Okay, guys, do you think your tan-colored skin and yellow eyes are not expected? Definitely, they are not expected if we are telling here or speaking here of physiologic jaundice. Since your patient is having a pathologic jaundice, so definitely this tan-colored skin and yellow eyes is normal or not? Okay, do you think that is normal or not? Okay, this is normal. Okay, so next. So urinating 20 times. Do you think urinating 20 times is expected? Okay, urinating 20 times is expected and that is normal. Okay? Urinating 20 times is expected and that is normal because the bladder voluntarily empties when stretched at a volume of 15 milliliters in infants. So if in the infant's bladder, if that already holds at least 15 milliliter of urine, so definitely there will be a involuntary or voluntary bladder emptying. So it is normal or expected that the infants should have urinate for at least 20 times. Okay, 20 times. So that is normal. Transitional stool appear by the third day after initiation of feeding, and greenish brown to yellowish brown, thin and less sticky than meconium stain. So meconium stain is abnormal, but we cannot rule out meconium stain here. These are also expected. So what is normal vital signs for infant? Okay. Temperature 36.5 to 37, that is normal. Apical heart is normal if it is only within 120 or 140 beats per minute, or 180, it's not normal. So as presented a while ago, the patient had a 180 beats per minute, so that is not normal. RR of 30 to 60 cycles per minute is normal, and the patient weighs is 2.5, I think. Okay, so the average birth weight for babies is around 3.5 kilos or 7.5 pounds, although between 2.5 kilograms or 5.5 pounds and 4.5 kilograms or 10 pounds is considered normal. So 3.4 kilos is normal. So it's within the normal limit. And the serum bilirubin, remember that the serum bilirubin peak on day 4 and usually reduces at day 14. Okay? So, the serum bilirubin of patient is 4.8. So, definitely that requires a follow-up that concerns us. That because our patient is considering is having rather a pathologic jaundice. Okay. So last for the test taking tips here. Okay, remember, you need to list down again the findings, then ask yourself if that is expected or normal outcome, or unexpected or abnormal outcome, or not requiring follow up. Breastfeeding, chest feeding every 2 to 3 hours without difficulty, that is a normal outcome. Urinates 12 to 15 times a day, that is also normal outcome. Had bowel movement 5 to 6 times per day, that is also normal outcome. Stool is greenish brown to yellowish brown, thin and less sticky in consistency that it has been, is also a expected or normal outcome. She looks tan and eyes look yellow. That is abnormal. That is already a jaundice. And we already established that your patient has a pathologic jaundice. Okay. Temperature of 99.6% or 6% rather degrees centigrade. That is an unexpected outcome. It requires follow up. An apical heart rate of 180, that is also an unexpected outcome. The RR of 70, okay, is also an unexpected outcome because until 60 is maximum. And serum bilirubin of 4.8 is also unexpected outcome. Okay. So I think that ends the examples for the test taking strategies for different test formats following the clinical judgment in as part of your next generation NCLEX, which will be implemented this 1st of April. So I wish for those who have stayed until the last part of this um, presentation. I wish you good luck if ever you will be taking the next generation NCLEX. And hopefully this topic will give you opportunity to identify the most important tips and strategies that you can effectively use during your examination. So I wish everyone a nice evening or a nice day. So from the Philippines, so on behalf of IPAS, in behalf of Kinetics, so thank you so much and see you all again to our next Kinetics College free live session. So thank you so much and have a nice day. Bye.